Hello and thank you for tuning into my weekly video message. I wanted to begin by letting you know that we proclaim September as African Heritage Month, which we have celebrated in various venues around the county. Montgomery County is the first jurisdiction in the United States to proclaim the month of September as African Heritage Month. We are home to more than 54,000 Africans who make up 15% of the overall immigrant population. Montgomery County is home to a wonderfully diverse African immigrant community that is a wonderful part of the diverse tapestry of every culture from every corner of the world that calls Montgomery County its home. Our African brothers and sisters own businesses, teach in our schools, serve in our government, and engage citizens throughout our neighborhoods. From food to music to art, the traditions and cultures from their native countries continue to live with them in our county. October is Domestic Violence Awareness Month, and unfortunately, we have seen an increase in domestic violence as a result of the stresses and hardships brought on by the pandemic. Throughout the month, communities and advocacy organizations across the country will be engaging with activities designed to raise awareness about domestic violence and ways to identify and stop it. Please visit montgomerycountymd.gov for more information or follow the Montgomery County Family Justice Center on Twitter, Instagram, and Facebook at MOCODVCC for events around your community and how you can help or volunteer to help others. Regarding this week's COVID update, I'm glad to say that we're starting to see some good trends as this latest wave of cases that we've experienced over the summer due to the Delta variant has begun to plateau and subside a little. Our test positivity rate and case rates are the best in the state, and our case rate is almost half of the state's overall average. We are now hovering between substantial and low transmission rates in Montgomery County, which is good news. When the most recent COVID surge hit our county, we took the necessary precautions, such as returning to indoor mask mandates, and the outcomes have proven that our decisions, along with our high vaccination rates, have resulted in Montgomery County being the safest large jurisdiction in this nation. When we can return to low transmission rates, we will be able to lift the indoor mask mandate once again. However, this pandemic is far from over. The vaccines have helped us to reduce deaths and hospitalizations, but the virus continues to spread. Our case rate today is about what it was at the end of February after the winter surge. That was the time when vaccines were scarce and we were spending most of our time indoors. Vaccines did not bring us the freedom nor the mission accomplished moment that people had hoped for, because the Delta variant was much more contagious than we could ever predict. And unfortunately, we're not able to convince a small but stubborn fraction of our population to get this shot. But this week, over 75.5% of our total population is fully vaccinated, and over 83% has at least one dose. 89% of the eligible population, those who are 12 and older, are fully vaccinated, and 98% of our eligible population has at least one dose. 95.9% of our 65 and older population is fully vaccinated, and 99.9% also has at least one dose. These are incredible numbers, and we would not have them if not for you. We are seeing a slight increase in vaccinations, not fast enough to make us happy. This is great news, as we're seeing a third of our cases and hospitalizations are people who've previously been vaccinated. These breakthrough cases are important to note that they can't happen to anyone. Last week I shared with the media the story of my son being a breakthrough case. He was sick for a few days, but after that he felt better. His vaccine likely stopped him from having to be hospitalized. When we look at who is becoming significantly ill and hospitalized, it is predominantly seniors, those over the age of 50. We hope that boosters may help with immunity response. Last week, the CDC recommended certain populations receive a booster shot of the Pfizer COVID vaccine at least 6 months after being fully vaccinated. These include people 65 years and older and residents in long-term care settings. People aged 50 to 64 with certain underlying medical conditions can get vaccinated, as can people 18 to 49 who are at a high risk for severe COVID due to their underlying medical conditions, or who are at increased risk for COVID because of their work situations. Booster shots are critically important. I encourage everyone to refer to the information available on the county's website that explains how the process works and when you can go to a vaccination site. Those who originally got the Pfizer shot should get the Pfizer shot again. Those who got Moderna should get Moderna, and J&J recipients should get J&J. However, at the moment, the only vaccine that's been approved for a booster has been the Pfizer vaccine. There are rumors spreading that there's a shortage of Pfizer vaccine due to these boosters. This is simply not true. The county's received over 2,300 Pfizer doses from Holy Cross Hospital, and based on our projections for the week, there's plenty of Pfizer to support the current demand at our county and community sites. Vaccines are widely available at over 200 vaccine sites in Montgomery County. We want to emphasize the priority of getting those unvaccinated first and second shots. As you can see from this map, vaccines are literally available everywhere in Montgomery County. We remain committed to working with our community and pharmacy partners on vaccine strategies, and nursing homes, group homes, and long-term care facilities and assisted living in the coming weeks. We are onboarding staff to develop surge capacity, and we will continue our pop-up sites. By October 11th, we plan to expand the volume so that we can do at our larger facilities in the East County Community Center, the Silver Spring Civic Building, and Montgomery College in Germantown. Driving down transmission rates, increasing vaccinations is leading to fewer cases and fewer quarantines in the schools. MCPS is currently screening in 109 schools, and we just have a 1.3% positivity rate. This is lower than the general community rate right now. I want to take a moment to acknowledge the work of MCPS over this first month of school. I know it was difficult. Managing this situation in our classrooms while also getting our children up to speed with in-class learning has been a completely unprecedented and complicated process, but they've stepped up to the challenge and have adjusted quickly and adeptly. I'm very glad of the partnership and collaboration we have with Dr. McKnight and her administration, as well as with the Board of Education. I also want to acknowledge the hard work of our own Dr. Crowell and our HHS department for the assistance and support to MCPS over the last month. There are going to be tough times ahead of us as the colder winter weather means more indoor time. We're going to need patience and partnerships with everyone as we focus on ensuring that our students get the education they deserve. I'm very concerned about the recent learning loss data that MCPS has published. It's clear that not being in school has harmed our children's learning. We must work hard to get these kids caught up, but we need to do it as safely as possible for them and for their families. Finally this week, Dr. Earl Stoddard was unanimously approved by the County Council to be our new Assistant Chief Administrative Officer focusing on health and public safety operations. Dr. Stoddard has been serving the county since 2016 and has been a key figure during the county's response to COVID-19, and he served as the director of the Montgomery County Office of Emergency Management and Homeland Security. I've been very appreciative of his advice and guidance since becoming county executive. The residents, stakeholders, and employees of Montgomery County are very fortunate that he accepted this increase in responsibilities. I was also pleased to announce the appointment this week of Sonia Mora, who will oversee early child care and education initiatives, children and family-related matters, and issues related to Montgomery County Public Schools, and Jake Weissman, who will have responsibility for economic development and business advancement activities. Sonia has over 3 decades of experience working in Montgomery County government and is an accomplished leader who currently serves as the director of the Por Nuestra Salud y Bienestar Initiative, a health initiative that focused on COVID-19 outreach to the Latino community and which contributed in a major way to the high vaccination rates that we've achieved in that community. Jake Weissman most recently served as Chief of Staff for the Maryland State Senate President. His experience and knowledge at the state level will help bolster Montgomery County's economic development efforts. He's an experienced manager of both staff and budgets and knows how to work collaboratively with diverse and varied coalitions. Thank you again for joining me today. Take care and have a great weekend.